Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello, doctor. How are you?
Very good. I have an IV in with my NAD and B vitamins today.
Don't think that the doctor gets the IV every week. It's just that we did two podcasts on the same day. But doctor, yes, we do have a very interesting topic today. We're gonna kick off the discussion about ALS, which is amyotrophic lateral sclerosis. Is that correct?
That's right. Amyotrophic lateral sclerosis. Correct.
Lateral sclerosis. Yeah. My English is not very well, so you may
No, you're
understand.
doing great. That's great.
So this is well, it's hard to pronounce, but what is it about this condition, doctor?
Okay, so a lot of people wonder if it's the same as Lou Gehrig's disease, and yes, absolutely it is. Sort of named after the athlete. So ALS is basically degeneration of the motor neurons. And as I mentioned in my last podcast, where we were talking about peripheral neuropathy um, and neuralgia, basically what's happening with the motor neurons is that they're breaking down, they're becoming the axons, the nerve sheaths are hardening and degenerating. So and so what happens is with the motor neurons being the ones that have to do with movement, okay, voluntary movement, which means walking, speaking, breathing, swallowing. When those neurons are affected, that affects our movement. And so that's basically what's going on is in Lou Gehrig's disease or in ALS is when there's a breakdown in the conduction of the axons and the nerves that have to do with movement. We're affected with ALS.
And there is upper and lower motor neurons.
That's right. The upper motor neurons have to do with the central nervous system, the brain, the brain to the spinal cord to the muscles, and then the lower motor neurons include the spinal cord to the muscles, and then the rest of the body. So yes, it affects both upper and lower neurons.
I see. And how can this affect our daily life, doctor?
So yes, so it can manifest with weakness, twitching, tremor. And then we see bigger things like tripping or loss of balance, inability to again the weakness. So pick up an arm to pick up a spoon, or even close your hand over a spoon or how whatever the case may be. So we see it, and then swallowing. We see a lot of swallowing. We see a lot of breathing issues. Speaking, absolutely, we see problems there. So all of the voluntary movements that you can think of have to do with the motor neurons being affected in ALS.
And what are the early signs, doctor?
Yes, so the twitching, the tremors, the weaknesses, loss of balance, tripping. Um, I think I mentioned the weakness. Those are the very typical early signs of ALS. We also tend to see behavioral changes, random laughing, crying, yawning, various different slurring of the speech. As I mentioned, sometimes we don't even realize that it's happening until it starts to happen so often, and then you start to see a trend in the behaviors, mental emotional behavior as well as movement behaviors.
Doctor, is this a genetic condition?
Genetics can be a part of it. I think that we don't really know, science really hasn't come up with a known root cause of the problem. However, uh, as in the case of autism, at least in my opinion, I think that there may be an underlying genetic predisposition, and then with the right environment or the right cues or not the right, I shouldn't say right because it's not right, but uh, with the correct trigger. It could be a chemical, it can be pollution, it can be um, whatever, just environment, or a bad diet. Even I think we have seen a correlation between high on antioxidant use and improvement in ALS conditions, for instance. So I think that diet can play a huge role. So there isn't a one known root cause, but I do believe that if there's a genetic predisposition to it, and if the situation presents itself with the triggers, it can result in ALS.
Is this considered neurodegenerative or is it autoimmune
Hmm.
disease?
That's a really good question because I think a lot of people tend to confuse multiple sclerosis or MS with ALS. MS is autoimmune. Okay, what happens is in autoimmune diseases, antibodies are created in the body by the lymph system to attack your own cells, auto being self. So in MS, antibodies are attacking the myelin sheath along the axons of the nerves. Okay, and that's what's causing the deficiency in movement and so on and so forth. However, in ALS, what's happening is that there is a degeneration of the nerves, and again, without any known cause. So there's a degeneration and an eventual hardening of the myelin sheath along the nerves. So that's what, and yeah, basically a breakdown of the axons and the nerves is what's happening with ALS.
Can the stem cells help to slow this condition from progressing, doctor?
Yes, absolutely. Our comprehensive treatment approach we have seen in some cases a remission of the conditions and of the disease, and an improvement of quality of life. And what we our goal primarily is to um, stop the progression and at least maintain. Where we're at if we're not so depleted. And then that's our first goal. Our second goal, and we always try to hit both at the same time with stem cells and with our whole treatment approach, is undo the damage that's been done. So the stem cells can, in effect, allow for regeneration of the axons. In many cases, more than one treatment is required to have a really profound effect. But after one treatment, we have seen improvements. Um, so again, it's about halting the progression of the disease and then undoing the damage, and that is by regenerating the axons, regenerating the neurons, regenerating and building up strength in the muscles that have been atrophied in the process. Because when we don't have normal nerve conduction, we see an atrophy of the muscles or a shrinking of the muscles and loss of strength, and that contributes to the weakness and the lack of ability to move.
Doctor, I never asked you this question, but can a stem cell cure a disease or can a stem cells stop the progress of a disease?
That is, Louise, that is a very, very important question to clarify the answer to. Stem cells have the ability to cure a disease, okay? Um, we have to be really careful in the way that we put this out there because we never want to give any false hope. Okay, we have seen patients go into indefinite remission. Now, is that a cure? That's up to the patient to decide. Okay, and many years go by before we see it come back. In some cases, yes, it does. We call it remission and then relapse. Relapsing means that it comes back. So so we have seen that happen. Now, again, is it remission or is it a cure? We can never say for sure. Okay, so that is a really good question for us to address.
For this condition, what would be the test that the patient needs to do before they come to Guatemala?
So what we usually, when a patient, before they come for treatment, they've already had their diagnosis. So we don't need to do any sort of diagnostic tests or anything like that. Uh, what we do like to have are baseline tests in order to see before and afters, objective before and afters. And so that would be the basic, a lot of the basic blood work. And then also, um, a lot of it is anecdotal. You know, we will see a patient being able to lift a spoon to their mouth, which they weren't able to do before, or start chewing their food, which they weren't able to do before, or swallow better, or start taking steps. So uh, these are all improvements that you can't really measure. It's a matter of seeing the before and afters. So when it comes to screening a patient, we will want to see some blood markers and certain key blood work and perhaps other exams in order to again establish a baseline and to ensure that they're healthy enough to undergo treatment, even though the treatment itself is not very invasive at all. It's an outpatient procedure, but we do need to ensure that the patient is healthy enough to be able to withstand and to forego or to proceed with treatment.
From time to time, we mention your complete package. What is it included in this complete package, doctor?
Yes, you know, and in this case, it's really important to reiterate that aspect of it because ALS is so complicated. It is a very complicated disease. It is difficult to treat. Um, and if we didn't have this comprehensive approach, I don't think we would get the results that we do. And so it's really important that patients and people, listeners and viewers, understand that we have to address this condition and all the conditions that we treat again, in a very comprehensive, sort of holistic way. We have to address detoxification because in almost every case there is a toxicity. Okay, so we need to address detoxification, and we do that in the form of a nutritional, um, antioxidant, and detoxifying IV. Very natural. We have suppositories that work with this IV. We also have vitamin shots, and then we have oxygen therapy to sort of rejuvenate the body and prepare the body along with growth hormone to create an environment of healing. And then we also use a very, very high dose antioxidant, um, not only in the IV, but also orally. And we have seen that to be very, very effective in ALS specifically, in a lot of disease conditions, but and patients, but especially in ALS. So that would be really important. And then, of course, which we wouldn't complete the comprehensive nature of this treatment without addressing mental, emotional, and spiritual well-being because you know, ALS is a devastating disease. You know, you can change and be depleted and become deficient from one day to the next in some cases. So it is a very difficult disease to mentally and emotionally and psychologically accept. So that is something that we need to address even before the patient comes and understands that that's part of the healing and the recovery. And then the stem cell enhancement formula, which I mentioned, where it's a very high dose antioxidant and whatever else we feel is necessary for the patient.
Very clear, doctor. I was wondering if ALS is a condition that older people are affected, or can it go to different ages?
You know, that is a very good question. We do find in the later stages of life or the elderly is when it tends to be affected more. And I think that's part of my theory in that the accumulation of toxins and then as well as age related depletion. Depletion of antioxidants and free radicals that accumulate
So, doctor, one last question. Why are you connected to an IV right now? Because I know you mentioned it on the podcast last week, but they might be wondering.
That's a good, yeah, it's a good question to ask again, Luis. So, yeah, so of course, I like to walk the talk. So I'm always having treatments on myself. This is a NAD IV with B vitamins and glutathione, and NAD being a lot of you have probably heard of NAD or NAD. It is the basically the energy production in the mitochondria. Mitochondria are the powerhouse of each cell, and so basically the end result of the food we eat and whatever we're trying to do to nourish our body and to gain energy and create ATP, it happens in the mitochondria. So the NAD is a fuel source for the mitochondria to create ATP. So this is a very powerful IV. It lasts about 2 hours long. And I had it going, and we thought, well, I didn't want to stop it for the recording, so we thought we'll just go ahead and record with the IV going. And that way, patients get also a chance to see part of what we do here.
Thank you, doctor. But I'm glad you're okay. There's nothing wrong with you. Well, I really appreciate your time as always, doctor. And I will see you next week.
Yes, thank you, Luis. You have a lovely weekend.
You too. Bye bye.
Thank you.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.